In your consumer news this morning, weekly jobless claims fell last week. The federal government reporting first-time applications for unemployment benefits decreased by 19,000 to 241,000. That even accounts for the effects of Hurricanes Milton and Helene. Economists expected those events to push claims higher. Meanwhile, continuing claims, or those who have filed for unemployment for at least 2 weeks, rose by 9,000 to 1.87 million. Activists are rallying at Kellogg's headquarters to protest the food company's use of artificial dyes in its foods, particularly red dye number 3, which according to data from the National Library of Medicine causes cancer in animals. A petition created that gathered more than 170,000 signatures asking to remove artificial food dye from its children's cereal was presented. In response, Kellogg says its ingredients are compliant with all relevant laws and regulations. The list of the most expensive U.S. zip codes is out, and one is the reigning champion, 94027, topping the list again for the 8th year in a row, Atherton, California. The median price of homes sold there in the community is nearly $8 million. It's followed by 2 New York zip, where median home prices are nearly $6 million. California leads the country with 7 zip codes in the top 10. 78% of the top 100 are in the California Bay Area, Metro Los Angeles, and the New York City metro area. Millions of Americans get health care coverage through their employer, and millions more are covered by federal programs, including Medicare. This is the time of year to take a look at those coverage plans and see if you need to make any changes. Jill Schlesinger has some advice for open enrollment.
It's open enrollment season, and small changes to your plan could save money. Start by creating a list of your doctors and prescriptions and determine whether they are still covered under your current plan. If your company offers it, investigate a high deductible health plan, which in exchange for that higher deductible offers lower premiums. To save for the larger deductible, the plan is paired with a triple tax advantage health savings account, meaning that the money that you contribute into the account goes in pre-tax. The earnings grow without taxes, and when you pull the money out, there's no tax due. If you leave your job, you can take your HSA with you and even use it decades in the future. If you're 65 or older, Medicare open enrollment is also underway through December 7th, and there are big changes for next year. The most important one impacts those who have Part D. That's the prescription drug plan. In 2025, out-of-pocket costs for medications will be capped at $2,000. But be aware, there could be increases in other parts of coverage, like co-payments and deductibles. Additionally, there will be fewer choices for standalone drug plans. Go to Medicare.gov to see whether your prescriptions are included in a plan and how much they're likely to cost.